With COVID vaccines on the fast track for approval, we could be a month away from seeing distribution.
And that means some people are thinking about whether they would get the vaccine once it becomes available. WPTV News Channel 5's Michelle Casada explains that includes pregnant women.
With 2020 almost at a close, we could see at least 2 COVID-19 vaccines authorized for use in the U.S. by the beginning of next year. We've heard from vaccine trial participants about what they experienced, but what seems to be missing from that pool, not surprising, pregnant women. Unable to have her fiance by her side during sonograms, KANDACE LAYTON is learning what it's like to be pregnant in a pandemic.
This is not exactly what I pictured my first pregnancy to look like.
Due in April, there's a lot to keep up with, including COVID-19 vaccine trials.
I feel that there isn't enough for us to know the ramifications of what happens after you get the COVID vaccine for pregnant women.
And that's a big question mark, even for board-certified OBGYN Dr. Colette Brown-Graham, practicing in Wellington for 25 years.
I'm a little concerned that pregnant women are not in the flow of getting the vaccine, but I understand why, and I don't know that we have any way around it. And at this point, how we got through, like I said, with the flu vaccine was people got the vaccine, oh my goodness, I'm pregnant. And then they found out that it was safe. And so that's the reason why. And that's probably what's going to happen with the COVID vaccine as well.
For many women, it will be a balance to determine risk. Jennifer Rodriguez actually had COVID when she was 17 weeks pregnant, but said her symptoms were mild.
All I can tell everyone is take good care of yourself. I never thought it would happen to me. And it did, but I'm very lucky that it wasn't anything severe.
In her case, she's likely to have developed antibodies and says she won't get the vaccine. Layton says she would consider the vaccine after delivery, but Annie Vera,
I think we might be in baby month right now, so.
She will deliver before a vaccine is distributed. And there's another factor to consider.
I've breastfed all my kids. This is my 4th baby.
Dr. Brown-Graham believes it will be safe for pregnant women at some point, just like it's safe and recommended for them to get the flu and whooping cough vaccines. But she's not making that call for her patients right now.
I had a very smart resident advisor who said, never be the first, never be the last, always be somewhere in the middle. So no, I'm not going to be the first OBGYN that says, yes, you're pregnant. Come get the vaccine.
Michelle Casada, WPTV News Channel 5.